Over the long term, high blood glucose levels can cause several complications. The most serious are heart attack and stroke. Diabetic neuropathy is a common complication whereby the nerves that connect the spinal cord to other organs are damaged. The feet are often affected due to poor circulation and nerve damage. Diabetes also affects the kidneys, causing nephropathy, where kidneys lose their ability to filter waste products. Diabetes can damage small blood vessels in the retina, causing diabetic retinopathy. This may result in loss of vision.
Prediabetes is when your blood glucose levels are higher than normal but not high enough to mean you have diabetes. Prediabetes is sometimes called impaired glucose tolerance or impaired fasting glucose. Most people with prediabetes have no symptoms, and it can only be detected with blood tests. Having prediabetes means you are likely to develop type 2 diabetes, and you could already be experiencing its health consequences. People with prediabetes have a higher risk of heart disease than people with normal blood glucose levels. You are more at risk for prediabetes if you are over 40, overweight, have a history of diabetes in your family, or are of Aboriginal, Hispanic, Asian, South Asian, or African descent. If you detect your prediabetes early, you can prevent or delay the onset of type 2 diabetes. Losing weight, getting exercise, and improving your eating habits can actually bring your blood glucose levels back to the normal range. For our full library of healthcare videos, blood sugar levels are measured by taking a blood test during a period of fasting, usually of around 8 hours without food. Typically, blood glucose levels are measured in the morning before any breakfast is eaten. When having your blood glucose levels measured, you should make sure you don't drink anything apart from water during the period of fasting. A fasting blood glucose test can be useful to see how well the body can manage blood sugar levels in the absence of food. When we do not eat for several hours, the body should release glucose into the blood via the liver, and in response to this, the body should produce insulin to stabilise blood sugar levels. A fasting blood glucose test therefore shows whether the body is able to bring down the blood glucose levels present from the previous meal, how effectively the body copes with its own production of glucose. The targets for fasting blood glucose levels are the same as the targets for before meal readings. For adults with diabetes, the target levels are between 4 and 7 millimoles per litre. For children with diabetes, the target levels are between 4 and 8 millimoles per litre. However, some people may be given individual targets by their doctor that differ to these. Fasting blood glucose tests for people with type 2 diabetes are useful for showing how well your body's insulin responds to periods without food, such as overnight. In type 1 diabetes, fasting blood glucose tests help to show whether your long-term insulin, or background insulin as it's sometimes known, is set to the right levels. If you're in any doubt, your healthcare team should be able to help you understand your levels and determine whether they need changing.
Hemoglobin A1C. Hemoglobin A1C
also known as glycated hemoglobin, glycosylated hemoglobin, HbA1c, A1c, or HbA1c, is a form of hemoglobin used to identify the average plasma glucose concentration over prolonged periods of time. It is a measure of the average level of glucose to which the hemoglobin has been exposed during the life cycle of a red blood cell, RBC. The HbA1c level is proportional to average blood glucose concentration over the previous 4 weeks to 3 months, and a high HbA1c represents poor glucose control. The criterion for diagnosis of diabetes, as per the American Diabetes Association Standards of Medical Care in Diabetes, is HbA1c value greater than or equal to 6.5%.
Health Break is brought to you by the University of Arizona Medical Center.
Diabetes is becoming an epidemic in America, but the good news is that you can prevent it, or if you have it, you can control it. That's why the University of Arizona Medical Center has established the Diabetes Prevention and Education Center, according to Dr. Mary Pendergrass.
We're trying to give people the right information they need to control their own disease. So we've got this exercise facility, cooking demonstration area, and then also a classroom.
The staff uses these wonderful facilities to teach practical lessons that can truly change lives.
We've got educational sessions on healthy eating. We have sessions on how to get started with physical activity. We also have sessions on diabetes prevention, which very much focus on if you're at risk for diabetes, what can you do about it?
To find out more, visit uahealth.com. For Health Break, I'm Beverly Herbert.
Health Break was brought to you by the University of Arizona Medical Center.